autism, cerebral folate deficiency, acetaminophen, all of those have been making a splash in the news lately. I'm Dr. Monika Buerger, and I've been working in this realm for over 30 years. So let's give a little information on what is cerebral folate deficiency. It is a deficiency of folate in the brain, not in the blood. So one, you will tend to see normal blood levels of folate in the blood, but they still can be deficient in the brain. The only way we can check if it's enough in the brain is doing a PET scan or a spinal tap to measure for those folate levels. And again, it's folate, not folic acid. So what are some signs and symptoms of cerebral folate deficiency? Psychomotor delays, developmental delays, movement disorders, ataxias, overall global neurodevelopmental challenges. One telltale sign with cerebral folate deficiency is cow's milk can further block those folate receptors in the brain. And these kiddos can have a backward slide in their developmental trajectory and their behavioral mechanisms when they have cow's milk. So cow's milk is a big no-no for those with cerebral folate deficiency. Mitochondrial disorders can further cause issues with those with cerebral folate deficiency. So it's really super important that we support the mitochondria. So that's why you can see low tone and motor delays, because they have both mitochondrial dysfunction as well as low folate in the brain. So you need to know how to manage these and take a keen eye as to why they might not be meeting their motor milestones, and what do you do about it? That's super important, especially in this day and age where we're seeing so many kids struggle. Vitamin A can be an adjunct. It can help potentially support these folate receptors in the brain. So potentially adding in vitamin A at the right doses and the right timing can be a help with these kiddos. So understanding what you are looking at, what you're dealing with, it is not simply adding in folate to their diet. It is adding folinic acid at a high dose. And we see that with a product called Leucovorin. You've heard of Leucovorin in the media lately a lot, as the FDA has now approved Leucovorin as a treatment mode for those with autism. Leucovorin is folinic acid at a very high dose in milligrams versus being able to get supplemental folinic acid at micrograms. So there's a lot of nuances to know and understand when we're talking about mitochondrial function, cerebral folate deficiency, folate receptor function, which can also be blocked with autoimmune disorders, supplementing with folinic acid at the right doses versus folate or folic acid or folinic acid at microgram doses. So that is some great pearls for you to understand as all this is coming in fast and furious in the media and with exciting news, but you need to understand how to use it, when to use it, what to look for. And that is where our Academy of Neurodevelopmental Practices is golden. Our Foundations of Neurodevelopmental certification course is something that every practitioner dealing with families and kiddos, the information they need to have, you need to know, you need to own in order to foster optimal neurodevelopment and to change the tide and change the trajectory of neurodevelopment and the life of these kiddos forever. Physical, chemical, mental, emotional health, and well-being. So scroll down, jump in, and join us now. Don't miss out on incredible, imperative information that you need to know in your practices for your families and your communities. I will see you on the inside.